All right, my people, let's do this. You guys are the OGs. We're on the home stretch. Again, this is our last unit before our spring break, last unit before our dissections. Let's go ahead and get this thing on the road. So, diving in the respiratory system, again, we're talking, first things that we're going to talk about is this individual that has CF. So, with cystic fibrosis, again, it is considered a genetic disease. Again, genetic disease slash disorder slash disruption of normal human bodily function, where the body produces thick, sticky mucus, especially in our lungs. Now, normally mucus is helpful. Again, helps trap dust and debris, but in CF, it becomes way too thick. So think about it this way: your airways are supposed to be open tubes. What happens if they get clogged? If they get clogged, air can't move as easily. That means less oxygen gets in, bacteria gets trapped, causing infections. So, some primary functions that we're gonna deal with. The first one's oxygen gas exchange. So again, we've already hit on this pretty heavily within our circulatory system unit, talking about blood, how it picks up oxygen, gets rid of CO2. Our next big function, sound production. So whether it's talking to me, talking to you, talking to your siblings, talking to your parents. Next, smell, sense of smell. So we'll talk about olfaction. Talks about how the olfactory bulb sends direct transmission back to your frontal lobe of your brain. And then we'll talk about pH regulation. That's going to be a really big one within this unit. But big takeaway, carbon dioxide levels directly affect our blood pH, and too much CO2 makes our blood too acidic. Now, there are really two main types of respiration. First one's an external, again, where it happens in the lungs and oxygen moves from air to blood. The second one's internal, happens in body tissues, oxygen moves from blood to cells. Now, if you need to think about it this way, think about how lungs act as our loading dock. Again, where they get everything ready to go, and our blood acts as the delivery truck that'll take either the CO2 or the oxygen back to the loading dock. That way we can either pick it up or we can drop it off. And then finally, our cells act as the housing that receives the oxygen or the O2. Receives the oxygen or the CO2. Now, again, if we're taking a look at it from a different perspective, looking at internal versus external, another big thing that you can take a look at is, again, how this all affects CF. So, again, with CF, again, we've already touched on how with CF, it's a progressive disorder that causes thick, sticky mucus primarily building up in our lungs, primarily. So think about that. Does that primarily affect your external or internal respiration? Answer is external. Again, that thick, sticky mucus is going to really clog your airways, primarily your bronchi and bronchioles, leading to airway obstruction, impaired gas exchange, and it can lead to some pretty gnarly chronic infections down the road. Now, why do we need oxygen? Again, you guys have learned early on in your science classes, mitochondria is the powerhouse of the cell. Again, that helps us produce ATP. Again, the energy your cells need to energy your cells actually use. And without oxygen, again, cells switch to backup systems and become less efficient. We see this buildup of lactic acid within our muscles, and that's where all this fatigue really comes from. So that's why sprinting that's part of the reason why sprinting burns and your body can't keep up with all the oxygen demand that it has. Next, as we look at the overall anatomy between our upper and lower respiratory tract, it's divided up into these main avenues. Within your upper, again, we're looking at your nose, your nasal cavity, your sinuses, and then your pharynx. And then within your lower, again, that's where we look at your larynx, trachea, and then your bronchi and lungs down further. Starting off within your nasal cavity mucus, Again, the inside of your nose is lined with that mucous membrane that again helps warm incoming air, helps moisten the cavity itself, trap particles, and it has all these tiny itty bitty little cilia, um, like organelle, that move mucus toward your throat. And fun fact, you swallow with that mucus all day without even noticing it. So, one of the other things that we've kind of touched on a little bit, as it also relates back to some of the salivary glands in it, and we can find a lot of these different glands within the same anatomical region of each other, is that they are found within the spaces of our bones, right? And they're named after the bone themselves. So again, this should be pretty straightforward for a lot of you guys, but these spaces between our bones and these paranasal sinuses help reduce the weight of our skull and our resonate chambers for your voice. So it plays a pretty big role within your voice. So that's why if you ever get some sort of a sinus infection, then you definitely can tell there's a change in your tone of voice. Next, you got your pharynx. So the pharynx is just a shared pathway for food and air. Now, again, with your pharynx, again, we have touched on a little bit again how your tonsils are found here. So whether it's your palatine, linguinal, or your tubular tonsils. But now we're going to take a closer look at a little bit more as in regards to how your epiglottis plays a role within this whole area of your upper respiratory tract. Now, within your epiglottis, again, it's often considered as the guardian of the airway. Oh, excuse me, I'm thinking of something else. I'm getting a little ahead of myself. But with your epiglottis itself, again, we've already touched on heavily how it helps control and acts as a secondary flap to either have food go through down your airway or down your digestive tract. So whenever you're coughing, whenever you're laughing, whenever you're talking, generally, again, that airway is often either open or closed depending on what mechanism you're doing, as you can kind of see over here in this anatomical image. Now your larynx really contains two main types of vocal cords, and we're going to dive into those. But before we dive into those, again, your larynx acts as this quote unquote guardian of the airway. Now, again, your larynx is surrounded by this is surrounded by all of this hyaline cartilage, and it has this shield-like shape to it, which protrudes anteriorly, so outward, away from our body, and is commonly known as our Adam's apple. So within your larynx, again, you also have this structure known as your glottis. So again, this is where we find our true vocal cords and your false vocal cords. Now, your true vocal cords are the ones that are helping produce all the sound, whereas your false vocal cords, again, they are the ones producing all that are help protecting your airway itself. Now, your true vocal cords, kind of like what you can see in this image down below, they help produce sound, they help manage breathing, they help protect your airway, but they vibrate hundreds of times per second. That way, they can help control sound waves, adjust tension to change your pitch, and open and close to control your airway, and operating as a rapid, precise, and complex valve. So it's really cool when it all comes down to it. But often cases, if you have any sort of inflammation with your vocal cords or with your larynx itself, it can lead to laryngitis, again, inflammation of your larynx. So, especially if you have a hoarse voice, anything like that, that's where this is coming back to. And if you have any sort of problems with it, you can just go and see an otolaryngologist, ear, nose, and throat doctor. All kind of play a role with this. Now your trachea is one of the next things, and this is one of the ones that I love to talk about. So with your trachea, again, it's our main windpipe that has a cylinder-like shape, travels from the larynx down about 4 inches of length to right around that your fifth thoracic vertebrae. So approximately right around your mid chest. But your trachea is fairly rigid because its walls are reinforced with those C-like shaped hyaline cartilage. And again, if those were to collapse, then your airway is going to collapse pretty quickly, and allows it to expand anteriorly when we swallow in a large piece of food, or when a large piece of food is making its way through your digestive system. But as that airway is making your way through your trachea, it'll then make its way into some of the main portions of it, and of that, and then within your bronchi. So again, you have your primary bronchi, like when we talked about other vessels, it's primarily called just common bronchi. Now then your secondary bronchi are again the next main branch points, and then your tertiary branch points are all the way at the end, followed by your bronchioles at the very bottom. Now your bronchioles again have air sacs called alveoli. Again, those are like those bulb-like protrusions where a lot of this gas exchange is really occurring, sending and supplying oxygen to your surrounding tissue. So as we kind of take a look at that over the next couple of days, that's what we're leading into. But in the meantime, I want you guys to go ahead and stop here with your notes. If you have questions, comments, concerns, please let me know. Go ahead and start. If you need to wrap up your test corrections, do that. If you need to work on your coloring packet, do that. And if not, I want you to work on the labeling sheet that's at the front of the room. Otherwise, y'all have a great day. We'll see you on Monday.